Good afternoon. My name is Paul Tutokey. I live in Billings, Montana with my lovely wife Trina and my awesome little girl. Well, she's 14 years old now, Katie Ann. And we have a dog, a leopard gecko, and a goldfish as well. I really started watching your guys' videos already, and I think that they show a lot of compassion, a lot of dedication to nursing. And I can't wait to watch the rest of them. I also look forward to meeting all of you guys at the immersions that we're going to be doing soon. I think we have one coming up February 11th and 12th. Me, well, I've been a psychiatric nurse for about 17 plus years. It's my calling. I have a passion for psychiatry. I love working in that field. About 10 years ago, though, I thought I was, I was getting burned out working with that population. And I took about a year sabbatical break from working in psychiatry, and I worked in internal med and diabetes. But at about the 6 to 9 month mark, psychiatry just really started calling my name again, and I went right back into it, and haven't had much burnout since. I've had my moments, but I really haven't had any burnout, I can't say. In looking at the Code of Ethics for Nurses, I think the thing that really speaks to me is Provision 1, and specifically 1.2, where it says nurses establish relationships of trust, provide nursing services according to need, setting aside any bias or prejudice. Factors such as culture, value systems, religious or spiritual beliefs, lifestyle, social support systems, sexual orientation, or gender expression, and primary language are to be considered when planning individual, family, and population-centered care. And also in Provision 2, 2.1, where it informs that each plan of care must reflect the fundamental commitment to nursing, to the uniqueness, worth, and dignity of the patient. That really speaks to me because I really have a passion for working with all the diverse populations and various ethnic backgrounds that the patients have that come in. I think through all of the years I've been in psychiatry, and the cultural competency type classes that I've taken, and all of the people that I've talked to and helped treat, have given me the skills to be able to relate to the patient no matter what their background is. I had a paper, oh, here we go, sorry. And just, some of the examples of some of the patients that come in here in Billings, Montana, into our psychiatric unit. Most of them are voluntary. We do have some that come in involuntary. But, like my guy from the Crow Nation that kept losing family members to meth and polysubstance abuse. My gal from the Northern Cheyenne Nation that kept losing family members to untreated medical problems, causing a lot of depression for both of them. The farmer that went bankrupt and turned to alcohol and didn't know where to go from there. Or the wife of the farmer who, out on the ranch, away from any towns or any socialization with others, starting to feel isolated, depressed, and lonely. I admitted a girl that I went to high school with, kind of remembered her in her glory time when she was doing a lot of sports and was a cheerleader, but came in, had been diagnosed in her early 20s with schizophrenia and was hallucinating and very disorganized. It's not always easy emotionally caring for these patients, but in the setting that I work in, and it's an acute setting, one of the joys of working in that setting is most of the time you do get to see huge improvements in these patients within, say, a 3 to 5 day period. I've admitted one of my past MSU, Montana State University professors who had lost a son to suicide and became depressed and suicidal himself. My auto insurance agent, and also a nurse from another part of the hospital. So I think when a lot of people think about psychiatry, they go right to thinking about the homeless or polysubstance abuse or those types of things, but that's not the majority, actually. It's people just like you and I that have the coping skills to help them deal with life's issues, but they often forget how to use them. And so it can be just anybody. And of course, we do have the patients who are admitted that come in psychotic and aggressive and are admitted on a hold and believe that they want to kill you. And sometimes they try with their fists or their feet, what have you. But we also get to see great improvements in those patients as well. I'm just thankful to be a registered nurse and be able to be a part in helping this population deal with their depression or deal with their psychosis, just helping them find the tools that will help them live more of the normal life and a life of quality. At any rate, I hope I didn't bore you guys, but that's kind of my philosophy of psych nursing. I'm glad that we've had the discussions about the assembling the global baby as well. That's kind of expanded my mind anyway. At any rate, I do look forward to meeting all of you, and good luck with your studies. Thanks a lot.